I know some of you have to be back at work by 1 o'clock, so I'll try and stick on time and get started. I'm interested in this. It's a personal interest, but it's becoming something that I see more and more clinical applications for. I'm a lung specialist by training, and so I thought we'd start with, you're all coming out of a busy day. Many of you understand that there's probably a pattern of breathing for every physical, mental, emotional state. If you're mad, excited, exercising, you breathe in a certain way. What some of you may not realize is that the breath works the other way. Breath is one of those automatic things. We don't think about it, but it actually is under our conscious control as well. And so we can actually influence our mental state through the pattern of breathing. So I'd like you all to close your eyes, please, and focus on your third eye. The mind's worrying about the future and the past. Just focus on your third eye and take 4 deep breaths in and out. Nice, big, slow inhalation, and slowly exhale the breath. And continue for 4 breaths. And keep your eyes closed. Continue to breathe in a relaxed fashion, focusing on the third eye, which is in between the eyebrows. And now what I'd like you to do is rub your palms together for about 8 seconds. And now slightly separate the palms and breathe down through your palms. Bring your attention to your palms and breathe very slowly. And slowly bring your palms together, but don't let them touch. Don't let them touch. Bring them to about 1 or 2 inches apart. And see what you sense. Do you sense a sort of a magnetism, an electric cushion, a stickiness? And play with that. Don't let your palms touch, and just separate, bring together, separate. This is energy. This is the energy that drives our autonomic nervous system. In yoga, we call it prana, and we'll talk about it a little later. You can open your eyes. Did anybody feel anything? A stickiness? A magnetism? It's real. It's very subtle. So anyway, now that you're all grounded, I'll just go into my talk. It's a lot to cover, and I'll try and cover it in a relaxed fashion so that there's time at the end to ask questions. So I'm not paid for this. I don't belong to any device company or drug company. I don't have any conflict of interest. This is really just my personal passion. My objectives today are fourfold. I'd like to hope that you'll understand how current nutritional choices accelerate the aging process, cause inflammation, and create what's called the metabolic syndrome. I hope that you'll learn to eat differently to what our popular culture and the processed food industry and agribusiness promotes. I'm going to highlight the benefits of exercise. And last but not least, I'd like to use yoga as a way to show you how to integrate the mind, the body, the spirit, and facilitate superior health. Can everybody hear me? Am I talking loud enough? Okay. So, if you've got a healthy mind, but you're disconnected spiritually and your body's sick, it's not really pure optimum health. You really need to integrate all 3 aspects of our humanity, and I hope that you'll appreciate why that is so at the end of this lecture. 2,500 years ago, Hippocrates, the father of modern allopathic medicine, said, "Let food be your medicine and your medicine be food." And it's a very true statement. He also said, "Walking is man's best medicine," and I'm going to show you some studies as to how profound and true that is. And he also said, and I believe this totally, that the greatest medicine of all is teaching people how not to need it. You are your own natural physicians. You just need to empower yourselves and understand that. This holistic approach, it's also called alternative or complementary medicine. It doesn't really matter what it's called. It's gaining traction. About a quarter of hospitals in the United States now offer some form of complementary medicine program. And maybe with enough dynamics and input on my behalf, we might be able to bring that forward in our hospital too. here in Casper. Back 4 years ago, the CDC did a survey of 30,000 people, and it revealed that 33% of American patients reported using complementary alternative medicine in the previous year. And I'm sure if I was to canvass this audience, it would probably be about the same. It's most frequently used for the management of stress, anxiety, pain, but I see much bigger applications for it than that. If you were to try and categorize it, it breaks down into about 5 different modalities. There's biological-based therapies, such as using fish oil to improve cardiovascular health, or using probiotics to reduce inflammatory bowel disease or incidence of antibiotic-related diarrhea. There's manipulation body-mind therapies, such as massage and chiropractic. There's mind-body approaches, such as meditation and yoga. There's energy medicines, such as Reiki therapy and acupuncture. And then there actually are alternative medical systems that really think about this very differently, such as traditional Chinese medicine, homeopathy, and Ayurvedic medicine. In our modern times, I think it would be fair to say that the majority of people have insufficient exercise, experience excess stress, they're overweight with high levels of inflammation and an attenuated immune response, and they've lost contact with their divinity, their soul, their spiritual dimension to their being. This is my impression. I've been practicing medicine for 20 years, and I really feel that this is an accurate sort of summary. The causes of death, this is 13 years old, but it still ranks the same. In the United States, our number 1 is heart disease, number 2 is cancer, number 3 is stroke, number 4 is COPD. That's sort of area I'm very familiar with. Number 7 is diabetes, number 10 is chronic liver disease. I would make the case that, obviously that's the majority of deaths every year if you take those diseases, that most of these diseases here are lifestyle related. COPD, the majority, over 95% of it's related to smoking. Stroke is related to atherosclerosis of the cerebral vascular system, which is most likely related to poor nutrition and inflammation. A third of cancers are believed to be related to obesity and diet, as well as other environmental factors. Diabetes, 95% of that is type 2, which is mostly related to the metabolic syndrome. Chronic liver disease, 50%, 60% of that is related to alcoholic hepatitis. These are all, in my opinion, preventable. What you may not realize is that there are new emerging risk factors for the number 1 killer in the United States. Vitamin D deficiency, central obesity, toxins, sedentary lifestyle, depression, stress, anger, hostility, caregiver role, social isolation, social support, purpose in life, inflammation as measured by C-reactive protein. In fact, C-reactive protein is a better marker for heart disease than LDL, which is one of the subtypes of cholesterol. So we're really starting to think about this differently. The Nurses' Health Study is an ongoing study, but in 2008 they discussed some of their results. And what they said is that more than 50% of the deaths amongst middle-aged women were attributable to a combination of smoking, obesity, low physical exercise, and poor diet. And what you may not appreciate is the fat cell, the adipocyte, is an inflammatory organ. It's just not benign fatty acids just sitting there. Adipocytokines, as they're called, is just a broad sort of term. It includes substances such as tumor necrosis factor alpha, leptin, interleukin-6, and adiponectin, and there's many more. But the point I'm trying to make is that these cytokines affect insulin-mediated glucose uptake and vascular inflammation. So obesity is not just benign in terms of its mechanical issues, it has an inflammatory component. This is the sort of State of the Union, which I think is not very optimistic. Average calorie consumption in the U.S. is about 3,770 calories a day. The percent of obese, this is very sad, it's just an epidemic. The percent of overweight obese children is 33%. The percent of obese overweight adults is 35%. The number of annual drug prescriptions on average is 12 in a given year. The annual average sugar intake is 142 pounds. And the percent of fast food as a part of the diet is 55% for America. Just to mention that we talk about obesity as the BMI, which is your weight in kilogram divided by your height, expressed in meters squared. And we classify obesity as, if it's less than 25, it's thought to be normal. If you're sort of just up to 30, is 25 to 30 is overweight. And then class 1 or mild, class 2, moderate, and class 3 is a BMI over 40 is what we call severe obesity. This is important as we go forward in a couple of slides. The number of obese people in the United States, this is from last month, so this is current information I'm giving you here. This is The Lancet, a very reputable British medical journal from August 26th. The number of obese people in the US will increase from 99 million in 2008 to 164 in 2030. And the cost of treating obesity-related diseases such as heart disease, stroke, diabetes would increase to 66 billion per year by the year 2030, which is a 2.6% increase in overall healthcare spending. And I would make the case that a new approach is needed, not only at a public health level, but at a personal lifestyle level. And the problem with modern healthcare, as I see it, is it's driven by economic incentive. Pharmaceutical companies and medical device companies are really driving our practice. If you take obesity, back in the 80s they had fen-phen, which is the magic bullet. It's an amphetamine that would make you lose weight. Well, it caused pulmonary hypertension. It was a disaster. But we're looking for that drive up, get the fix type of thing. And, you know, the device companies, the lap band and bypass surgery, were trying to treat obesity as if there's a quick fix to it surgically. We focus on symptom control with scant attention to the underlying causes. And little time is spent to understand the person with the disease, which I think is fundamental. And we're very quick to perform interventions and prescribe drugs. And I really think that this is what doctors should be doing. We should be coaches, we should be inspiring, we should be educating, we should be teaching, but mostly we should be empowering people. And I hope at the end of my talk today you'll feel that I've achieved some of that anyway. This is this guy you might recognize on the street somewhere today, but this is Neolithic man. That's about 2.6 million years ago. This is sort of Paleolithic man about 10,000 years ago, and this is 2011 man. And you know, there's a whole sort of growing body of information, literature, and proponents that if we were to eat more likely to what our genes are designed for, 2.6 million years ago, the genes are very similar to what they are today. 10,000 years ago, from a genetic point of view, there's hardly any change. So we're actually genetically primed to metabolize and digest simple, natural nutrition, not all this processed stuff. And so if we can eat more like our Paleolithic ancestors, we're going to not get this metabolic syndrome. And I'll just spend a minute or less talking about the metabolic syndrome. Metabolic syndrome is basically, it's also called syndrome X or insulin resistance syndrome. And there's environmental issues, genetic, but mostly lifestyle issues. And it's a sort of tip of the iceberg phenomenon. It's associated with these sort of four things: type 2 diabetes, which is, you know, found initially with hyperglycemia and a low HDL and a high triglyceride level. The type 2 diabetes is first discovered with hyperglycemia, like a fasting glucose of greater than 110. The dyslipidemia is two things, essentially a low HDL, that's the good HDL that goes up when you exercise, and high triglycerides. High blood pressure underlies the hypertension, and abdominal obesity, or a BMI greater than 30, is what we see in terms of obesity. And these go on to cause cardiovascular events, most particularly stroke, cerebrovascular accident, and heart attack, myocardial infarction. And this whole thing is being driven by the way we eat. This central obesity that they talk about, is a waistline greater than 40 inches in men and greater than 35 inches in women. And this is how it works. This is simplistic, but this is basically a summary of the metabolic syndrome. Nutrition of the current culture and sedentary lifestyle are major risk factors. You eat foods that give you a very high glucose level, a high glycemic index, and that pushes up, when you have a lot of glucose, that increases your triglycerides and visceral fat and inflammation. You get, if you're having to constantly secrete insulin to bring down your glucose, you get insulin resistance, and obviously with time you develop full-blown diabetes. All of this is easy to understand how it could cause atherosclerosis of the vascular system and inflammation and vasospasm, and then hypertension will very simply go on to accelerate atherosclerotic coronary artery disease and increase your risk of stroke. So that brings me to the first part of my talk, which is nutrition. This talk is going to boil down into three sections: nutrition as a sort of a key issue, and exercise, and last but not least, mind-body techniques such as yoga. Again, this is where we are nutritionally. We have this dilemma: do we go for something that may be very simple and easy, or thought to be healthy, or do we go for the cup cookie? Do we go for this that will cause a lot of inflammation in the body? It's called the Standard American Diet, and I like the acronym SAD. It's very sad. The Standard American Diet is refined flour, refined sugar, preservatives, additives, pesticides, hormones, animal protein, alcohol, caffeine, artificial sweeteners and chemicals, and trans fats. And this gives increased glycemic load. It inverts the normal sodium-potassium ratio, and there's a dramatic drop in the fiber content of our diet. And so many of the foods we eat today are completely novel substances from an evolutionary perspective. You can imagine Paleolithic man trying to eat all this. Well, that's who we are, and it's really all changed in the last several hundred years, which is nothing from an evolutionary point of view. So cake and chips and cookies and candies and condiments and crackers and breakfast cereal and bagels and bakery goods and pizzas and rolls and ice cream and soft drinks and salad dressings and snack food and muffins, and it goes on and on and on. This is not good stuff. 40% of the total energy consumption of a typical U.S. diet is supplied by foods implicated in the etiology of this metabolic syndrome. So just because you can eat it doesn't mean it's food. And so grains are probably fine if we were to have whole grains like whole wheat, which includes the germ and the endosperm and the bran. This is where all the fiber is. But refined grains, back a few hundred, say 2,000 years ago, they would roll a stone over grains, and then they'd sieve it a little bit, but you'd get a lot of the actual grain there. Now with the Industrial Revolution, you had these steel mills and these sifting things, and basically all we got was the endosperm, which was refined flours. And so these pastas and breads that are refined, and commercial cereals and corn and rice, they really push up blood glucose levels and precipitate this whole insulin resistance syndrome. And there's a huge feeling that we need to move away from a diet of white to a diet of diversity, meaning eat the rainbow, eat all the colors, stay away from all the white stuff. The U.S. Department of Agriculture would tell you that this is the food pyramid that we should look to, and I think you've probably all seen this being advertised as the way we should eat in modern society. I spoke with this guy and got permission to use his food pyramid. He's thought to be the grandfather of the Paleolithic movement, Arthur Devaney. And his food pyramid is very different. All those grains are gone and dairy products are gone. Okay? And his food pyramid is basically, essentially 5 levels deep, I think. Water when you're thirsty, lots of vegetables, lots of meat and seafood, lots of fruits, avocados, oils, nuts, and then spices. It doesn't show very well, but and that's the thing. If at the end you would like this slideshow, what you should do is put your email address down, and we can email it to you. so don't feel like a pressure to write too much. This is Mr. Devaney, or Dr. Devaney. He's 74. He looks like he's 25 years younger. This is his book that came out this year. I don't get a kickback, but I would encourage you to read this book. I think it's a wonderful book about how to exercise and how to eat. Very, very simple. It's called The New Evolution Diet. This is another guy that I read a little bit about, and he's 58. He's got the body of an Olympic athlete in his 20s. And he's the author of the Primal Blueprint and the Primal Blueprint Cookbook. His name's Mark Sesson. And there's many, many people who live this lifestyle but are very intellectual, academic, and there's multiple doctors and nutritionists and scientists who are promoting this sort of Paleolithic approach. In terms of reading, I would suggest you read two books. The New Evolution Diet, for the reasons I outlined. And then this, I'm not going to talk about cancer, but this book is very, very empowering as to how you can really improve your immune system to give you the best chances to, number one, prevent cancer, but if you do have cancer, to make your other modalities work better. He's a doctor from Harvard who got glioblastoma multiforme, brain cancer, kept going into relapse. He figured out that there's a different way to eat and exercise, and it's called Anti-Cancer: A New Way of Life. I've met him. I've seen him at conferences. This is a very, very good book. It's really done much better than anything I could do in 45 minutes. So there's your bedtime, your homework, your reading. But if you go back to the new food pyramid, basically it's vegetables. I just put 20 vegetables here, but you know, the advantages of modern living are that we can go to Safeway and get vegetables from all over the world 365 days a year. So it's not all negative that we've modernized. In terms of protein, there's meats. We're very lucky in Wyoming. Game meat is you know, buffalo and elk, but we can get lamb, you can get lean beef. It's important to know that the advantages of grass-fed meat are preferable. These big sort of commercial farm lots where they have thousands of cows eating corn and grain cause a tremendous inflammation in the animal's meat because it's very high on omega-6 fatty acids. And omega-6 they break down to arachidonic acid, and that causes inflammation. So if we eat the meat of animals that have been agribusiness farmed with a lot of corn food feeding, we end up with a very high omega-6 level in our blood, and this precipitates inflammation. So I would emphasize grass-fed, organic grass-fed animals, pork, veal. In terms of poultry, free-range poultry is preferable for the same reason. This commercialization of the poultry business, feeding them corn, giving them antibiotics, giving them, you know, hormones and everything, is not healthy. You get a huge amount of omega-6 fatty acids. But duck, turkey, chicken, seafood, you know, there's just basically the larger fish such as king mackerel, swordfish, and tuna should be eaten sparingly as they contain higher concentrations of mercury from the smaller fish they eat. But, you know, you can put together, and that's the other thing, if you read these books, there's just so many creative, beautiful ways to eat like this. It's not, I'm not a great cook, but I can figure it out, so I think it's something that is very doable. In terms of fruit, I've maybe put 18 or 20 fruits here, but avoid dried fruits, fruit juice, and canned fruits. In terms of nuts and oils, working up the pyramid, these are all good. And then lastly, there's the different fresh spices that you can use with your food. I'd just like to bring your attention, so this is not all intellectual woo-woo. I'd like to give you some studies to show what this type of nutrition has done in controlled studies. So the Lyon Heart Study, 5-year randomized control trial, 605 chronic heart disease patients. What they found, 70% reduction in cardiovascular events. No tablet's going to give you that, okay? 70% reduction. 60% reduction in all-cause mortality, 80% reduction in late cancer. And this Mediterranean diet is very much along the lines of the Paleolithic type of diet. It's a lot of more fruit, less meat, a lot of veggies, no cream, no butter, plenty use of olive oil and canola oil. And here's another study in JAMA, the effect of the Mediterranean-style diet on endothelial dysfunction and markers of vascular inflammation in the metabolic syndrome, a randomized trial. And basically what they found is when they went and studied the cytokines and everything, there was a dramatic, significant drop in C-reactive protein, interleukin 6, 7, 18, and insulin resistance. And the bottom line was that this Mediterranean-style diet might be effective in reducing the prevalence of the metabolic syndrome and its associated risk. So I would tell you, shop the periphery and stay away from the aisles when you go to Safeway. Just shop around the edge of the store. That's where all the good stuff is. All the processed foods in the middle. So that brings me to the next issue of exercise. And I'm putting in my own quote here since everyone's got a quote, so I just made up my own. I basically think that optimum health and a sense of being fully alive is impossible without embracing some form of physical activity or exercise. The studies are so obvious, but really you can't. We're designed to exercise. I'm not asking you to be crazy on the extreme, but exercise is your friend. Here's a study showing 21 volunteers aged 18 to 22. So these are young people. You can imagine the metabolic benefits in people in their 60s. But these guys were 18 to 22. And there was a 5% rise in HDL. These are all very significant. The total cholesterol divided by HDL ratio dropped by 12%, and the time to exhaustion increased by 8% in those performing stair climbing exercises 16 minutes a day. 16 minutes a day, all right? Don't tell me we can't do that. For 7 weeks versus sedentary controls. Huge improvement in metabolic profile. In diabetes, these are physicians, 21,000 physicians. The relative risk of developing type 2 diabetes was 0.64, which is essentially another way of saying there was a 40% reduction in the risk in those exercising more than once per week. And it was a 50% reduction, or relative risk reduction of 0.52 in those exercising 5 times a week versus those exercising less than once a week. So if you want to decrease your risk of developing diabetes mellitus, that is the way to go in terms of exercise. Here's a study on obesity. 56 obese sedentary women exercised 5 days a week, increasing from 20 to 40 minutes a day over 20 weeks. Those exercising in short bouts adhered to the program better and lost 20 pounds versus 14 pounds in the long bout group. So it does not need to be 55, 65, 85 minutes in the gym. And these people who promote more intense, sort of shorter bursts have a lot of data, and you'll see it if you read, particularly the book by Devaney. But you don't need to do these sort of marathon workouts. Here's a sad thing, and it just gets to TV and children. Among 500 students, a mean age of 12, a 1-hour increase in watching TV for 6 months was associated with 106 kilocalorie per hour increase in total energy intake. A decrease in energy intake was associated with an hour of physical activity was 292 kilocalories per hour, but it was overridden by the consumption of about 100 calories more than they just burned in exercise. Each hour increase in TV viewing was associated with a weight increase of 0.38 kilograms. Nothing wrong with TV. There's lots of entertainment and education in it, but it does have to be controlled in a modern environment. Neurology, 200 elderly subjects were randomized to engage in Tai Chi or just education, 45 minutes a week for 15 weeks. The fear of falling responses was reduced in the Tai Chi group versus the education group, highly significant. And the Tai Chi group reduced the risk of multiple falls by about 50%. Gynecology, exercise and gynecology. In 23 premenopausal women between the age of 45 and 55, those regulated to aerobic exercises 30 minutes 3 times a week at 75 to 85% of maximum capacity for 12 weeks experienced a 43% reduction in premenstrual syndrome symptoms versus a 7% reduction in the strength training group. So PMS gets better with exercise. Now, if men weren't convinced that exercise would help them, hopefully this will push you over the edge. In 78 sedentary, I think maybe they weren't healthy because they were so sedentary, but anyway, in 78 sedentary healthy men exercised at 75 to 80% of maximum aerobic capacity, 60 minutes a day, 3.5 days a week for 9 months. had a result of enhanced sexual activity with a 30% increase in the frequency of sexual intercourse. These are all very significant. Increased libido and decreased difficulty in maintaining erections. So that shows the benefit of exercise on healthy sex life. In ophthalmology, 9 sedentary subjects aged 25 to 60 with suspected glaucoma engaged in aerobic exercise for 40 minutes 4 times a week for 12 weeks at 70 to 85% of maximum heart rate. The mean intraocular pressure fell from 24 to 19. Exercise helps your eyes too. And I'm going to end here. I could go on and on. It goes on. The data for exercise is so overwhelming. But this is actually from the Lancet last month. In Taiwan, they've got incredible statistics. The Taiwan National Research Institute tracked over 416,000 people for 13 years, and they analyzed their health records and reported the levels of physical exercise. And what they found is after taking into account differences in age, weight, sex, and a range of health-related indicators such as risk factors for heart disease, they found that 15 minutes, this is the point I want to make, 15 minutes of moderate exercise, brisk walking, a day increased life expectancy by 3 years compared to those who remained inactive. And they also in this study showed that daily exercise was associated with a lower incidence of cancer. And this is from the Lancet of last month. So Gandhi said, you must be the change you wish to see in the world. You can't go out and just fundamentally change the world. You have to start with yourself. And so I really believe this, and these are my kids, and they didn't want to run the Boulder this year, and it's like, oh, Dad. But I got them to do it, and afterwards it's a 10K run, and, you know, they're 12, 14, 16. They're like, can we do it again next year? And they're like telling their friends about it. So really, if you start with yourself, you can have a ripple effect in your family, your friends, your colleagues, your community. So I'd like to talk a little bit about stress. I'm sure no one here is stressed. You're all pre-selected. You live very balanced lives. But stress is endemic. There's relationship stress, work stress, financial stress, all sorts of stress. And basically, it's the flight or flight response. You know, our autonomic nervous system has a parasympathetic arm, which is sort of basically mediated by the vagus nerve. And our sympathetic nervous system is mediated by the sympathetic chain. And what it does is it accelerates the heartbeat. It decreases peristalsis. It increases the conversion of glycogen to glucose. It increases the secretion of cortisol, adrenaline, noradrenaline. It gets you ready for the saber-toothed tiger that's about to eat you. But a lot of stress is internal. It's mental. It comes from our emotions. It comes from our thoughts. There's nothing actually going to happen to us compared to millennia ago. But stress is not all bad. There's good stress and what they call distress. So basically, as stress increases, performance gets better up to a point, and then it's a sort of an inverted U-shaped curve. The more we continue to increase stress, you basically see a decrease in performance, in health, and breakdown. And stress can cause, you know, headaches, feelings of despair, lack of energy, sadness, nervousness, anger, irritability, memory problems, panic attacks, anxiety, depression, muscle aches, tension in the back of the neck, rise in blood pressure, nausea, heartburn, weight gain, constipation, diarrhea, irregular menses, reduced sexual desire, lowered ability to fight and recover illness. And there's a growing body of evidence showing that high stress affects our immune system and increases the risk for cancer. So stress is, at the extremes is very unproductive. And chronic stress is a risk factor for the metabolic syndrome. I just told you what the metabolic syndrome is, but chronic stress activates the hypothalamic pituitary adrenal axis, increasing the outpouring of cortisol, and that pushes up glucose levels and therefore insulin levels, and high insulin levels promote visceral adiposity, insulin resistance, dyslipidemia, and hypertension. And there's a synergistic effect when you couple this with sedentary lifestyle, standard American diet, and smoking. So stress is our worst internal enemy, so to speak. But there's a way out. It's called the relaxation response, and I tried to give you a little bit of an example of that when you came in. You don't need to be a yogi sitting on the top of the Himalayas to get a relaxation response. It's something that you can use your breath and meditation to evoke very quickly. Herbert Benson from Harvard is most famous for studying this. It's a relaxation response. It's a physical state of deep rest and change that the physical and emotional response to, the relaxation response is a physical state of deep rest that changes the physical and emotional response to stress and is the opposite of the fight or flight response. So animals know this response very well. We can induce it within, a minute or two of deep breathing. It can, yes, be done in nature's beauty, but it can be done at work too. And it doesn't have to be sitting still. You can get into this meditative arena through motion. The yoga that I practice is very meditative yoga, and it can induce the relaxation response. But Qigong and Tai Chi, they all can do the same. And basically, it slows the heart rate, drops the blood pressure, improves the immune system, improves libido, improves sleep, slows down the brain waves. So if you look here, this is alert now. My brain waves are going at about 15 to 30 cycles per second. As I start to get more calm and meditative, it goes into this is beta brain waves, alpha brain waves, and this is deep meditation, theta brain waves, and then this is sleep, delta brain waves. And so I use that as a way to segue into what I think is probably the most useful part of the talk from a practical issue. I want you to understand the benefits of nutrition and exercise, but I want to use yoga as a way to help you understand the mental, emotional, physical, spiritual dimension of our health. This is the man that has taught me all I know about yoga. He's Yogi Amrit Desai. He's 80 years of age. He writes. He goes on lectures throughout the world. He's a musician, an artist. He's just so vibrant and alive, and he'd probably live to be 120. But he's one of the founders of yoga. He's in his 80s, and he started Kripalu Institute up near Boston, and now he lives in Florida. But basically, his method's called Amrit Method of Yoga. And so I'm going to give you a little bit of my philosophy, or the philosophy of yoga. Yoga is a physical practice that I'm sure you all know increases endurance, strength, flexibility, and balance. No question about that. But it also incorporates a deeper spiritual dimension. The postures are asanas. They're meant to box you in. And as you're in an asana, the intensity of the posture increases as you find your edge, so to speak. And you notice an increased chattering of the mind. It's like, I hate this. When's he going to stop? Let's stop this posture. And you begin to realize that this is not actually who you are. We think we're our mind. We are not our mind. Who you are is what is noticing all of this going on. Who we really are is consciousness. We're all just consciousness. And you start to realize that there's a little self with a small s, our self-image, that has started in childhood and it's grown with us throughout our life. And there's a big self, which is consciousness. And you begin to realize that you are not your small, limited self-image. You start to have a greater capacity to accept what is, and yoga enables you to still the mind, and stilling the mind enables you to see who you are not. And you begin to react less and feel more. In yogic terms, we have misnamed ourselves. What we call small self is not the big self. And in the West, you go to the gym and it's said, we do this posture, do that posture, we're doing yoga. And I would make the case that a posture is a place to practice yoga. The postures aren't yoga. They're just to get you into the way of understanding how the body and mind are interacting. And yoga is withdrawing of the identification with the mind and the ego. The self-image is made up of incomplete, inaccurate perceptions from our past, and the mind has a tendency to repeatedly replay the script in the movie. The mind says nothing new. It never does. It's always in the past or the future, and I'm sure you can hear yourself saying it's the same old stuff, that chattering, that monkey mind coming up and up again. And basically, we start to disassociate from that. We have forgotten that we are not this limited construct of the mind. We are consciousness with an infinite capacity, just like the sky. The sky can have kites going through it, planes going through it, clouds, weather systems. It just accepts everything. Yoga teaches you that. Disease arises when we identify with this ongoing negative conversation of the mind. It's not a stretch for me to tell you that people who are constantly negative have more stress and all the consequences of stress. Yoga teaches you to connect with prana, our inner divine energy or intelligence, if you will, that rejuvenates, heals, and is self-balancing. Right now, there's about 10,000 things going on in my body. There's enzyme paths converting, there's my blood pressure being regulated, my digestion, everything's going on. You think I'm controlling that I can do all that things? I can't even juggle 2 tennis balls at the same time. It's hard for me to breathe alternatively through different nostrils. And all these thousands of things are going on. We call it the autonomic nervous system. In yogic terms, it's prana, it's our innate intelligence, it's a divine intelligence. It's what runs our entire autonomic nervous system. And creating balance between the sympathetic and parasympathetic nervous system is a platform for optimum health. In the current modern era, we're so much in our sympathetic nervous system. We're constantly in the fight or flight mode. How many of us are very, very calm, relaxed, and meditative? And we need to bring back some of this parasympathetic function into our lives. And as I tried to show you, stress underlies many of the chronic diseases in our modern era. Allowing prana to work optimally is also a byproduct of yogic practice. In terms of healing yourself, you are your own physician. You just need to understand how to activate this natural healing response. Yoga works from the gross to the subtle. There's the body, it's fairly gross. There's the breath, it's a little subtle. There's the mind, and then there's the spirit. Yoga works on all of this. To practice yoga is to integrate the mind, the body, and the spirit. And yoga provides a medium for us to experience our true nature. Optimum health is an elusive mirage without the integration of the mind, the body, and the spirit. So yoga is not just a process for the yoga mat. Even if you do 2 hours of yoga every day, that's less than 10% of your day. So you might say, well, yeah, I don't want to do yoga. I don't want to go to the gym. You can do it at home. But the benefits of yoga are not for the yoga mat, okay? Yoga basically life will present you every day, and I guarantee you it will, with an abundance of psychic postures. Someone's right in your face, they're just pushing your buttons, it's like, and you're like, how do you relax with this? How do you not become reactive? Because reaction is basically a reactivation of past self-image and concepts. And how do you break away from that pattern? And so when you practice yoga, you start to apply these skills to everyday life. You catch the mind in reaction. You disengage from the ego and the little self dimension of the mind. You listen to your inner wisdom, and you attenuate the fight or flight response. This is my experience. And when you move in the world of people who apply this in their life, it's very real. But you don't have to believe me. I'm going to give you some studies, because this is evidence-based medicine as well. So I'm going to show you some of the benefits of yoga in terms of the literature. I like this posture. It's the heart. So basically, this is a randomized controlled trial conducted in India. Obviously, yoga is a lot easier to sort of enroll people for in India. They had 33. It's a small study, but I want to just show you the point. 33 hypertensive patients randomized to one of 3 groups: yoga, medications, or no therapy. And yoga was performed at home for 6 hours per week, and included a combination of asanas, which are postures, pranayama, which are breathing techniques, and mantras, which are just repeating sounds that have vibrational energy. So that's what they did. And the patients were followed for 11 weeks. And the results at the end was a mean drop in the systolic blood pressure in the yoga group of 33 millimeters of mercury. Control group went down by 4. And the medication group, not surprisingly, went down by 24%. But yoga did better than medication. And all these differences were statistically significant compared with both the control group and the medication group. And this was published in the Journal of Clinical Hypertension, which isn't a throwaway magazine. It's a top-notch journal. And you might say, well, 33 millimeters of mercury, what's the big deal? Well, basically, data from meta-analysis of 61 prospective observational studies on hypertension and mortality demonstrated that even a small 2-millimeter drop in systolic blood pressure was associated with a 7% lower risk of ischemic heart disease death and a 10% lower risk of stroke death. So 33 millimeters is a big deal. Studies show that yoga and yogic lifestyles benefit cardiovascular disease risk factors, strength, flexibility, osteoarthritis, irritable bowel syndrome, vasomotor symptoms of menopause. I could go on and on. And for those of you who are interested, the government has set up now the National Center for Complementary and Alternative Medicine called NCAM. And there's literally thousands of studies in there. And you go to www.ncam.nih.gov and you click on Find Research Results by Topic, and you can go into acupuncture, chiropractic, Reiki therapy, yoga, whatever. And, you know, my job is not to just spit out every study that's ever been done. There's a huge body of literature. I just wanted to focus a little bit on hypertension. But I would like to talk about chronic back pain, low back pain, because we are the epicenter for back surgery in the world. We don't just come top in the United States. We're the world's #1 because there are more neurosurgeons in the United States of America than anywhere else in the world. And this was, you know, in the Wyoming Business Report, July 1st, 2009, they talked about the Dartmouth Atlas project, which analyzes Medicare data. And basically, Casper, Wyoming, led the nation in back pain surgery in 2005. So I'm not going to comment about that, except to say that tells me that we're not entertaining other modalities in the treatment of low back pain. There's no way that this is the world's center for neurosurgery and we are all in need of surgery for low back pain. And basically, if you look at the Annals of Internal Medicine, there's a joint clinical practice guideline from the American College of Physicians and the American Pain Society, and they recommend in their guidelines yoga. And just to be fair, they also in the same article recommend chiropractic treatment and acupuncture and many other modalities for low back pain. So if you have low back pain and your doctor sends you to the surgeon, maybe it's okay to give yourself a couple of months with other modalities. Radical thought. But massage therapy is also, this is from this year, this is July 5th, Annals of Internal Medicine. So this is only 4 months old. Basically, they looked at 2 types of massage. One was the sort of relaxing Swedish massage that you probably all heard about, and the other one was called structural massage, which is a different type of massage. And basically, they showed, I'm not going to give you all the p-values and everything, but basically, massage therapy, it was effective, but they like to be sort of conservative. This is a big-time medical journal. Annals of Internal Medicine is one of the big ones. It's up there with the New England Journal of Medicine. Massage therapy may be effective for the treatment of chronic back pain with benefits lasting at least 6 months. So I just want to mention that since back pain is very common in Casper. So in summary, I hope that I've been able to show you that with regards to nutrition, you are what your metabolism gets to digest. Eat from nature's food pyramid. Exercise, we are designed to move. A little is better than a lot. When in doubt, walk for 15 minutes a day. We have beautiful nature here in Casper. There's no reason all year round why we couldn't walk. Maybe some months are more difficult. Yoga, physical, mental, spiritual benefits are huge, and it retards the aging process, allows the body's natural intelligence to heal and restore balance. And so I'd like to end with a quote that really talks about this spiritual dimension. It's my favorite quote. It's a long one, but I really love this quote. It's by Marianne Williamson, who's a lecturer, author, spiritual person. Our deepest fear is not that we are inadequate. Our deepest fear is that we are powerful beyond measure. It is our light, not our darkness, that most frightens us. We ask ourselves, who am I to be brilliant, gorgeous, talented, fabulous? Actually, who are you not to be? You are a child of God. Your playing small doesn't serve the world. There is nothing enlightened about shrinking so that people won't feel insecure around you. We were born to manifest the glory of God that is within us. It's not just in some of us, it's in everyone. And as we let our own light shine, we unconsciously give other people permission to do the same. As we are liberated from our own fear, our presence automatically liberates others.